to the PDR class today. Our topic is on the PMA Code of Ethics and Patients' Rights. Okay, we have invited Dr. Martina Alcantara to be our resource person. Dr. Alcantara is a graduate of UERM College of Medicine. She's an internist and a nephrologist, and she has been part of the training committee of the UERM residency training program in internal medicine. Okay, Dr. Alcantara, you have the floor.
Thank you, sir.
Thank you.
Can you see my slides, sir? Thank you.
Hindi pa. Share
Wait.
screen ka ulit.
Teka po. Ay, for a while.
There, we can see it. Okay.
Okay, so good morning, everyone. So it is my pleasure to lecture to you, on the PMA Code of Ethics and Patients' Rights. So the objectives of this session would be first to familiarize the students, that is you, with the Philippine Medical Association Code of Ethics and the Filipino Patients Bill of Rights as part of the medical curriculum. So you are young in this journey, no? And secondly, to describe to some extent the patient and physician relationships in preparation for your clinical practice. So let's go to the preamble. So this code of ethics is promulgated to provide the physicians with proper ethical and professional standards. No? So I've just highlighted the important points in our practice of medicine. Why? Because we want to ensure the safety and welfare of our patients. So we have several groups of people that we have responsibilities towards too, as physicians, and they are patients, the healthcare system, the community, our colleagues in the profession, allied professionals, the healthcare products industry. So if we maintain these proper ethical and professional standards in our daily life as a physician, we obtain or we maintain the honorable tradition that confers us with the well-deserved title of a friend of mankind. So nandun na yung adulation and respect for us just because we are physicians. And we must cherish this title, and live up to its name. Now, this is the outline. So we will start with the fundamental and then the general principles from which all of these tenets come from. And then we will go into each and every group of groups of people that I have alluded to in the preamble. Now, we go to the fundamental principles. So by dictionary meaning, when we say fundamental, it means necessary or core or base from which everything it has the central importance from which all the other principles will come from. So namely, number one is respect for life. So the right to life is inviolable. We cannot violate that, It is a necessary condition. Maintenance of life is a necessary condition for all other human goods. So it must be protected and promoted at all its stages. So we believe from conception to its natural end. Second is the respect for person. Bakit? Why do we respect a person? Because the person's intrinsic worth and dignity should be recognized. So the worth of a patient, of a person, or a group of people is intrinsic to our nature. Okay? And thus, the physician-patient relationship must be always cognizant of this, and respectful of each patient's autonomy. Third is social justice. So all patients have a right to basic health care and a just process in the allocation of resources. So hindi lang tayo, but our government and our local government and the national government should also be mindful of this. Fourth is the principle of beneficence. So the interest of the patient should be placed above all, no? In treating a patient. Yan ang unang-una. So societal pressures, financial gains, and administrative exigencies or hardships shall not compromise this principle. So only the benefit of the patient should be first. And lastly, of course, if we are mindful of the four, then alam natin to, no? Primum non nocere. Primum, primarily, no harm. So the foremost responsibility of a physician is to do no harm to his patients. Now we go to the general principles, no? So ito naman how physicians should act or how the physician should think or appear rather. So the primary objective of the practice of medicine is service to mankind. So if you're in here for the fame, for money, for continuing of your family line as doctors, we have to rethink, no? May gawa tayo ng konting introspection because our primary objective as doctors in the future would be service to mankind. So as physicians, we should be upright, diligent, no? Masipag tayo, sober, modest, imbued with professionalism, and of course, well-versed with the science and the art and ethics of medicine. So we have to maintain a certain decorum, which will be elucidated later on, no, in greater detail. And we should pass our certifying exams. Third, we should promote health, no, of our patients as the primary consideration, as I've emphasized in the fundamental principles. Fourthly, physicians should also be good citizens, good Filipino citizens. We must conform to the laws, no, and proper subject ourselves to proper authorities. So dapat nagbabayad tayo ng taxes, no? Sumusunod tayo sa batas, trapiko, and everything, no? Hindi pa pwedeng we are above the law, no? We are good citizens first and foremost. Physicians should work together in harmony and mutual respect, no? And six, should cooperate with other healthcare professionals in the context of interprofessional and collaborative practice. So, in our practice in the future, no, hindi lang tayo mag-isa usually. We have allied professionals like nurses, rehab medicine, dialysis units, no? And we rely upon the expertise of other doctors to help solve the problems of our patients. Lastly, physicians, although they have certain rights in relation to their patients, shall always observe dictum of service beyond call. Ibig sabihin, in emergency situations, we should answer, no? Maglapat tayo ng first aid, no? Hindi pwedeng i-deny natin that we are physicians. Now, the first group of people that we are responsible for are, of course, our patients, no? So there are 9 points in this article, and we will go through them one by one. First is professional competence, no? So we are in here for the long haul, meaning not after our learning is lifelong. We have to be dedicated to providing holistic, competent, compassionate medical care, pero dapat laging updated, no? So after our passing our board exam, finishing our residencies or fellowship, hindi pa pwedeng puro experience na lang, no? We have to continue studying. Now, patients' trust, no? Patients and physicians, they maintain a fiduciary relationship, trustful relationship. Why? Because these patients may be with us for the rest of their lives. We may be treating their families, friends, and other referrals. So we have to maintain this basic trust between our patients, among our patients. Third is human dignity. So alam natin that each person has his intrinsic worth, autonomy, okay? And whenever we deal with them, it should not always be only professional, no? But courteous. So in doing physical examination in particular, we have to be modest, caring, and gender sensitive. Okay? Kailangan meron silang consent when we do examinations, no? So example is, for example, you are a male physician and then your patient is a female. So when you need to, for example, examine the abdomen or other sensitive areas of the body, we have to ask permission, no? Make sure that there is another female companion in the room, whether it is another doctor, your secretary, nurse, or the patient's relative. Okay? And maintain the patient's dignity and anonymity at all times. Okay? Now, as physicians, we have to charge our patients. No? So there is that dictum no, on professional fees. Ang dictum dito is we have to be reasonable no, in charging. And we should charge commensurate first to the service rendered, nature of the case, mahirap ba? Simple lang. Time consumed, the risk involved, no? And pwede rin as the professional standing natin in the community and correlate that, of course, with the financial status of the patient. So, we're not here to, when we see a patient and a case, hindi pwedeng iniisip natin agad yung bayad, no? Isipin muna natin how to treat this patient and then later on charge. Fifth is disclosure. All right. So as physicians, we shall exercise good faith, honesty, and tact, no, in expressing our opinions. Siyempre, nagpapatingin sila sa atin, so we will tell them our diagnosis, probable differentials, no? Different diagnostic options, anong gagawin natin, laboratory, procedures, etc. Treatment options, ano bang risks nito, and the prognosis of the patient, no? So we cannot conceal or understate or exaggerate a patient's condition. Now, as we go along with the relationship no, of treating these patients, something happens, no? Improving or worsening conditions foreseen on our foreseen complications during the treatment or during the workup, we have to inform the patient and the family, for example, no? We have to analyze each step. So, nandun tayo in every step of the way. Should we need another doctor, no? Appropriate specialist referral for serious or very difficult cases or something beyond your control, then you should offer it or tell the family. All right? Because in the end, we have to promote the health, no? Good health of the patient. So physicians shall compose understandable, legible, no? Dapat magandang sulat na iintindihan. Written communications in such cases. Or tumawag. Okay, so ang doktor dapat malinaw magsulat. Myth yung magulo magsulat. 6 is autonomy. So bakit natin dinidisclose everything, no? Because the patient has to voluntarily submit his consent, no? For any procedure, treatment, diagnostic man or hindi. It will be based on his own free will and choice. That's why we have to provide information in a simple and understandable manner, leading to patient's acceptance or refusal. So even if your patient is a doctor, no, meron siyang sakit, meron siyang iniintinding problem, medical health issue, sometimes, it's not appropriate for us to be talking in the medical parlance, no? So kung hindi marunong mag-Ingles yung pasyente, then gamitin natin na Tagalog or is appropriate language that he understands. Okay? Now, privacy and confidentiality. So we have to take note of this, no, in the age of advanced technology, internet, no, data manipulation, AI. So we should always bear in mind that we hold private and highly confidential anything that we discover, no, pertinent to our patient's condition, even after death, no? Except when required by law, like in the last COVID pandemic, we have to declare that this patient died of COVID because funeral arrangement, post-mortem care, and general public health safety will be compromised if we didn't say so, right? In emergency cases, no, we have to respond. A physician, no, provided, of course, that there's no risk to our safety, we have to administer at least first aid treatment. So, and then possibly refer the patient to a more competent physician or facility. So, for example, you're in the airport, mall, gym, no? Dito nangyayari ito. So, we have to respond because above, kahit na ENT ka and then you see somebody collapsing there, sasabihin mo, hindi ako internal medicine or adult doctor ka, a child, no, collapses. So, mas may alam pa rin tayo sa general public. Okay? So we have to initiate treatment even without the prior consent of the patient or the relative, no, or lalo na kung wala silang consciousness, no. But if somebody there is with the patient, then identify yourself and just say that you're going to give some emergency aid, okay, and then possibly refer the patient accordingly. Now, this is the decorum or behavior of a physician towards his patients that I was talking to earlier. So, of course, as physicians, we are also free to choose whom to serve, except in emergency cases. So ano ba to? For example, a patient comes to me and there is an obstructive stone or a mass in his kidneys, no? So I am not a surgeon, no, much less a urologist. So I will have to explain to the best of my knowledge what this problem is and then possibly refer to the proper channel. Okay? Now, we have to demonstrate professionalism at all times. We have already alluded to that. We have to be humble, show empathy and compassion always to our patients. Hindi pwedeng galit ka agad or dinidismiss mo agad yung sinasabi ng patient, no? Okay. And we have to attend, no, to the patients within the limits of our capability, no? And we have to refer to somebody if you feel that you are not capable or adequately trained to handle such situations. And in difficult cases or hindi tayo magkaintindihan or the patient cannot accept his diagnosis, then offer a second opinion, right? And we should never exploit our patients for any personal gain, money-wise or non-monetary. Now, secondly, we have responsibilities to the healthcare system. So, first and foremost is improving quality of care. So I've mentioned earlier that as physicians, we are in this profession for the lifetime of our practice, no? So we are encouraged to maintain competence through lifelong study, no, and working collaboratively with our other professionals. So paano natin gagawin ito, no? So we have to actively participate in the development and application of better measures of quality of care. So ano examples nito? We have to attend our societies conferences, no? Usually annual and once or twice a year yan, no? And if we have subspecialties, we have to attend them because they are continuing medical educations. They have units, no? Hindi tayo babalik sa eskwela unless you are going to train for something else, no? And we have to, before we can revalidate our licenses, they require these units. Now, secondly is improving access to care. So, physicians must take initiative, no, to ensure that our patients are able to access, no, healthcare. So, for example, if you want to serve, no, the less fortunate strata of our society, we can engage in the public sector, no? Pwedeng pumunta tayo sa isang government facility, pwede tayong magpa-accredit doon and do our service. Or if you're in a private institution naman, no, and kita mo naman that your patient cannot afford your hospital or your institution, tulungan natin sila to acquire healthcare services that are affordable for their financial status. Thirdly is cost-effective management, no, of limited healthcare resources. So, we have to consider the cost of the diagnostic treatment and procedures, no. I'm not saying that we should always order the cheapest laboratory available, no. It is not that. We have to be cost efficient, meaning if this single best diagnostic procedure can, debunk all other differentials, then pagawa natin yun. Kasi it will save time and resources for our patients. We should always avoid superfluous tests and procedures. That's why when we see them in the clinics or when we do our bedside rounds, we explain to them, no, especially for the first time or the second time if they cannot really get it the first time, no, everything that the nature of the disease may entail para alam nila how to respond with regards their financial capabilities. Now, as physicians, we will be dealing with researches, okay? Whether We just read the research, we participate in research as primary investigators, co-investigators, or somebody who can enroll their patients. No, we have to ensure first that this research has been approved by the ethics board of our local institution or national institution if it is a really big study. No? And we should look into the study. Ano ba yung criteria for such researches that we read or participate in? So the objective, of course, must be relevant. And the problem or the topic that is being investigated has been sufficiently researched. Nagbasa na, may background check na, no? Hindi yung kung ano lang gustong i-test, gagawa akong research. No. Okay? Thirdly, of course, the research should contribute to some solution and it should be feasible and appropriate for example, if you're going to enroll your patients, no? And be mindful that babasahin natin that the risk involved in subjecting, for example, our patients should be minimal and the benefit should be greater. And of course, lastly, it can improve the healthcare system in general and our practice, no, for that matter, for this particular research that we are participating in. Now, thirdly, sa community, no, we have responsibilities to the community. First, to the government and the duly constituted health authorities. So sa government, paano tayo nakakatulong? So possibly in formulation and proper implementation of healthcare policies. So for our societies or the medical society, Philippine Medical Society, or our own individual expertise have societies, no, they may be part of some policy health formulation. We can join them, no? Acting as expert witness in some cases, mapapatawag tayo, whether in the local institution natin or sa court talaga, no? Then we have to be ready. We have to be ready to provide up-to-date and accurate information on health issues. So in the last pandemic, no, we doctors have to update ourselves about COVID-19 kasi tayo dapat ang mas nakakaalam. Ano ang myth, ano ang tama, kasi tayo ang tatanungin, no? And we have to assist in promotion of health and safety. Now, for duly constituted authorities, no, so we can cooperate, no, in the health authorities by education of the community. Marami yan, no? We can do educating on prevention of diseases. For example, just yesterday, no, World Kidney Day, no? So each and every institution, meron kaming sarili-sariling program in promoting health of kidney, no? Okay, marami rin yan, anti-diabetes, tuberculosis, sa newborn, etc. Secondly, we have to attend to victims in times of pandemic, epidemic, calamity, provided that our own safety is not at stake. So, we should always be mindful ano ay yung mga communicable diseases or non-communicable diseases that can be prevented, no, in our communities in general. Thirdly, okay, as physicians, we have to protect our community from unlicensed practitioners. So, pag meron kayong alam dyan na hindi naman talaga doktor, nagpa-practice as a doctor. More so, no, giving treatments, no, that are not that are entirely wrong. For example, a cancer patient stopping all his chemo treatments and just taking herbal medication. So we have to report them because we have to protect the community in general. Now, as physicians, we can promote our practice, no? Para naman alam nila sino ka, anong pwede mong ibigay sa pasyente and your community. But we cannot employ, agents for solicitation. So hindi tayo artista, no? We cannot do that. If we do promote our practice, we can resort to professional cards, calling cards sa internet, for example, sa web link ng inyong ospital or your institution where you practice, in their directories and in their signboards, no? Kung magsa-signboard ka, meron lang specific length or size, rather, 1 by 2 meters. And what is contained in your information? Of course, your name, your field of specialty, office hours, probably a contact number of your secretary or of your clinic, and other hospital affiliations. Yun lang. All other things that you are proud of, like special diplomas, certificates, whatever, no? You have to display them within the confines of your clinic. So yung signboard, maaring applicable if you're practicing in the province, okay? Because let's say wala namang masyadong internet or access yung patient to your information. Pero hindi dapat yung signboard mo, pagpasok pa lang ng NLEX, nandun na yung signboard mo. No? Doon lang sa area, sa community. Now, for media exposure, sometimes you are called to discuss important subjects, no? Whether in radio, television, or sometimes in community discussions or lecture-based discussions, no? So, lagi tayong evidence-based, no, in dishing out information. And we have to disclose any potential conflicts if relevant to these gatherings. We should not be identified as commercial endorsers of medical products. I-explain mo yung gamot para sa disease, no? For example, anti-TB sa tuberculosis, but hindi mo dapat pinopromote yung particular product or brand. Okay. Now, we have responsibilities to the profession itself, no? So ito yung nasabi natin kanina, continuing professional development or continuing medical education. Yun na yung parang term ngayon, ano? CPD, CME, continuing medical education, because this code was written 2019. Why do we need to do that? As I explained earlier, we have to maintain our competence and fitness to practice. So this is the only way that our societies or associations can sort of verify, no, that we are updating ourselves. Now, regarding professional interactions, no, physicians have an obligation to maintain a good image of the profession of being a doctor. Okay? So, like what I've said earlier, if we're going to involve ourselves in the following, no, clinical trials, committees, research papers, formation of therapeutic guidelines, journals, even, face-to-face Zoom discussions, presentations, dapat dinideclare natin yung ating conflict of interest. Like, nagtrabaho po ako sa certain company na to who produces this product. Okay? But our discussion or our contribution to this scientific activity should always be evidence-based. Okay? Thirdly, andyan ulit, no? Laging inuulit, professional decorum. Upright, diligent, sober, and modest in dealing with problem. No? Pati yung pagdadamit natin dapat appropriate. Hindi tayo flamboyant, no? Hindi naman tayo mukhang kawawa. I mean, to put it that way, no? So, we should always be mindful of our professional decorum. Now, we have responsibilities to our colleagues, no, in the medical profession. All right? Kung isusumbong natin yung mga hindi naman licensed professional, no, yung colleague natin who are licensed, no, to practice the medicine in whatever field, no, we have to always be mindful of protecting their good name. Ano yan? So, for example, lagi yan pupunta sa clinic, scenario, pupunta sa clinic, nagre-reklamo sa isang pasyente. So, like for example, I'm a nephrologist, pupunta sa akin, magre-reklamo, for example, for another nephrologist for whatever reason, no? Hindi natin dapat, we should not add more coal into the fire, no? Even if we know that it is true. For example, laging late yan, tapos ang bilis-bilis mag-check up, ganyan, no? So, don't add, coal into the fire or firewood into the fire, no? So, we should always protect, no? Lagi natin sasabihin, okay, baka po at this time, ito lang po talaga yung presentation ninyo. That's why the other nephrologists thought this way, no? For whatever reason, so huwag natin sisiraan yung kanilang pangalan. Now, professional courtesy to colleagues. So, we will be treating our colleagues, no? Siyempre, tao rin ng doktor, nagkakasakit din. We have to waive our professional fee whenever we treat our colleagues, their spouse, their children, and their parents, lalo na yung parents, because they were the ones, for example, in truth, no, who paid for your education. Even if the professional fee is embedded in packages, like, for example, cabbage, no, coronary artery bypass. So, nandun na kasi yung professional fee sa total bill, no, patanggal mo because this is a colleague of yours. Thirdly, unfortunately, there can be conflict in management among physicians, no? And we have to settle this difference of opinions or actual conflicts in proper forum for due process. So firstly, we usually, in the era of Zoom and advanced in technology, we can, talk among ourselves face to face or through the media, no, internet. But sadly, if we cannot resolve our conflicts, then we have to go into the following committees. The department where you belong, institution or the hospital. Nako, pwede rin PMA or the PRC. Huwag naman sana makarating doon. Okay. Fourthly, substitution for suspended patient care. All right. Now, in cases wherein we cannot attend to our patients, may sakit tayo, magbabakasyon tayo, no? We have to assign a reliever or a substitute physician who may have similar qualifications, no? And competent to treat the patients with the same dedication and quality of care that you are giving. And we have to inform our patients, no, or their relatives or their caregivers that such a substitution for a particular time will happen. Okay? And hindi tayo sisingil while we are not attending, no, to the patient. Now, going back to professional compensation, all right, so we will be managing a patient, no? Marami tayong doktor, a few of us, because of the necessary referrals, for example, no? So, again, our professional fees should be reasonable, guided always by the patient's capacity to pay. Kailangan may adjust yan. For example, unforeseen circumstances ensued, no? So, tumagal yung patient sa hospital. Siyempre, na-deplete ang funds. So, even if at the start, nag-usap kayo, for example, for this cholecystectomy, ito ang bayad ko, etc. But there were complications. So, we should always be ready to hand in discounts or to change our professional fees. And we should charge them, no? Correlating with the standard fees in the community or other doctors, right? So, we should not receive mga referral fees. Admitting ko tong patient to, gallbladder surgery ko to, no? Kasi bibigyan niya ako ng referral fee. Hindi. Mali yun. Okay? And in cases of emergencies, as we have discussed earlier, we should respond, no? Examine and treat the patient accordingly. All right? So, in case, of course, that this patient has his own doctor, his own hospital, then saka natin i-transfer. Now, kung hindi available yung doctor na yon or sobrang layo sa hospital niyang kinasanayan na pinuntahan, then treat the patient and later transfer the patient, no? And we share, no? Hindi yung porket ikaw nakakuha ng emergency, hindi mo naman pala, halimbawa, nag-atake sa puso, an acute myocardial infarction, you're a pulmonologist or a gastroenterologist, then you have to refer accordingly. Okay, another group of persons would be the allied health professionals. So, sino ba to? Like, for example, the nurses, no? For example, the rehab medicine, no? Like, kami ni Dr. Chua, no? We are nephrologists, so we usually deal with hemodialysis units, no? So, we work as a team, no? We cannot overemphasize that because we accept the same responsibility, no? So we have to give the full support, respect, and cooperation for quality maintenance. Okay? Secondly, we have to safeguard the interest, no? Interest dignity. So, yung reputation, dignity ng ating allied health professionals, no? And we have to maintain always propriety, no? You have to treat them with respect. We cannot harass, abuse, exploit, bully our nurses, technicians, no, we cannot do that. We treat them as co-equals, co-equals in a way that we cannot achieve, for example, dialysis without our competent nurses. Okay. So legitimate practice, illegitimate practice of medicine, as mentioned earlier, no, we can report, no, these unlicensed physicians or practitioners. Okay, we also have professional responsibilities to the health product industry. Sino ba ito? So they are the drug companies or companies that make medicines, drugs, laboratory machines, procedures, lab tests. So we should always think of the common good, no? So we have to provide quality medical care. So we as physicians, dapat we obtain accurate, viable, valuable, accurate, or repeatable scientific information from healthcare products bago natin siya gamitin among our patients. Right? Ethical and professional conducts. So how do we conduct ourselves, no? We must ensure that they do not take advantage of us and we do not exploit them in return. So the physician should not solicit favors, no, from these biopharmaceutical and medical device companies for any personal interest of gain. So ano ba yung ibig sabihin natin? So whenever we attend, for example, their activities, we should always exercise sound judgment, restraint, discipline, no, in participating in their activities. It cannot be construed na porket nag-attend ka ng kanilang activity ay you are now a promoter of their product. No, you are there to learn about their specific product or service. Physicians shall not rely solely on the financial support of these companies in complying with our CPDs or CMEs. So, for example, you are a physician in the province going to Manila to attend our national convention. Kailangan natin yan, di ba? So, they offered you a trip, a fare, a modest accommodation, possibly some meals, that's it, no? Huwag natin silang obligahin na, gastusan pati yung family mo, kung isasama mo, ikaw na yon. So, anything that will help you with attainment of your CPD units, pwede tayong tulungan. But we must not abuse. Okay. So, if we are naman called to be resource persons for their particular product, no, pwede yon, no? But again, there is a fine line between, being a resource speaker for this particular device, service, medicine that you are, for example, using kasi effective sa patient mo, but you are not bound to promote, prescribe any particular product of theirs. Okay? Pati yung ating mga prescription pads, dapat tayo na yung nagpapagawa nun. Wala na yung advertisement nila. And we should never accept rebates just because ginamit natin yung product nila, may rebate. Okay? Maaring recommend mo kasi may discount sa pasyente, mga promo nila, inform our patients. But wala sa atin. All for the patients. Sadly, if there are violations, no, of this code of ethics, we may, and there could be sufficient grounds for, one, baka ma-reprimand tayo ng PMA, suspend, wag naman, revocate our certificate of registration. Okay. The second part would be the part on the Bill of Rights of our patients. So ito mas madali because we already know as physicians how to conduct ourselves. And why? No? Because these are the rights that we have to protect. So first and foremost, the patient has a right to considerate and respectful care. So na-discuss na natin yan from the time of the fundamental principles to the general principles. Our patient, we should recognize the intrinsic worth, dignity of our patient, no? Protect the life of our patient, promote it from conception to its natural end. Okay? So that's why they have the autonomy, no? We have to give, secondly, relevant, current, understandable information about their problem, medical problem, whether it is a diagnosis, diagnostic, treatment, or prognosis. Why? Because the patient will have to decide for themselves. no, with their family possibly or alone, no, what will be their course of treatment. Except in emergency situations. We cannot hide, we cannot conceal na tayo ay physician. Alright? Especially when the patient ay walang malay. They lack decision-making capacity at that moment. And the need for medical aid is urgent. Now, our patients or our surrogate decision makers or families, no, have a right to know sino-sino yung mga involved sa treatment ng iyong pasyente, no? For example, dialysis patient ko, I have to refer to a cardiologist because of a very, problematic heart, no? So sino siya? Anong gagawin sa kanya? Ano kaya yung possible cost rather ng kanyang eventual treatment? So the patient has a right to make decisions about the care of plan of care, no? Prior to, pwedeng during the course of treatment. They have a right to refuse any recommended treatment or plan of care to the extent permitted by law. So for example, cancer patients, stage 4, there's no hope of reversal. There are other complications, no? And then your patient requests euthanasia. That cannot be. All right? Because it is against the law, against the hospital policy, and against our sworn statement, no, as physicians. All right? So, kahit na pag-usapan na ninyo yung plan of care, nag-accede siya, nag-comply siya, but during the course of treatment, there are problems being encountered, no? And sometimes, for example, they cannot anymore tolerate, no, the side effects, for example, of chemotherapy, hemodialysis, or heart failure regimen, no? And they want to stop dialysis, for example, or stop chemo treatment. Pwede naman yon, no? For as long as you talk it over, alam nila what will happen, all right? But other things like abortion, euthanasia, hindi po pwede, no? By law and by hospital policy, and of course, by our intrinsic sworn declaration as physicians. So, in cases of refusal, for example, for whatever reason, ayaw na ng pasyente sa'yo, sa iyong institution or whatever, or lilipat ng lugar, no? The patient is entitled to appropriate care and services to your hospital and possible transfer to another hospital. So we have to provide proper endorsements, no? Para naman hindi nangangapa yung pasyente, yung sasalinan mong team of doctors and medical health professionals. All right. Now, the patient also has a right to an advance directive. Okay, may living will ba siya o meron siyang professed directive, no? Siya ba ang nagdi-decide or there is a surrogate decision maker? Okay? So this will have to be honored by the hospital. For example, there is a living will that he must not be intubated or resuscitated in case of cardiopulmonary arrest, no, wherein the reversibility of the situation is dim, no? For example, a very big or large hemorrhagic bleed in the brain, no? So, kung meron mga ganung will, dapat naka-attach na ngayon sa chart or express, no? We have to honor it. Or the surrogate decision maker. Yung mga will naman na yan, sometimes if they decide to override that, no, pwede rin naman for as long as the communication is always open. Now, the healthcare institutions, the hospitals or the hospitals or the institutions wherein they are admitted must advise the patients of their rights under the law and the hospital policies. Okay? So, as I've said earlier, the information may be attached to the patient's record. So the patient has the right to timely information about these hospital policies, no? So if they don't want to be intubated or refuse any IV medicines already, they may opt to, go home, receive palliative treatment in the comfort of their home. Pwede rin yun. Hindi natin sila pipilitin na, no, we have to do this sa hospital lang ito, no? If they are fully cognizant of their course of the disease and the complications of treatment, then they can decide for themselves. We have to maintain the dignity of the person. No? So the patient has a right to every consideration of privacy. All right? So yung mga case discussion, consultation, examination, we have to protect the patient's privacy. Kung nagpe-present ka as residents, no, this case, hindi natin sasabihin yung totoong pangalan, just the initials, the age, the sex, saan nakatira, basic information. Alright? If we need to discuss this case with a colleague, hindi mo na kailangan sabihin na yung ganito, ito pasyente ko, ito problema. No, we just discuss the case. And you don't discuss your patients with another patient. No? You just say that sa mga pasyente kong nakita with the similar conditions, ito ang nangyayari. 6, the patient has a right to expect all communications and records pertaining to his or her care to be treated as confidential by the hospital. As mentioned earlier, in cases of public health hazard. So the hospital cannot just dish out your information to anybody unless required by law, no? Kung may court case or kailangan mo sabihin, COVID-19 kinamatay ng patient for proper post-mortem care and funeral services. That will not harm the public. All right? The patient has the right to review his own records, no? Karapatan niya 'yan, pero dapat i-explain mo rin, no? Kasi baka ma-misinterpret ng pasyente. The patient has a right to expect that within its capacities and policies, the hospital or the doctors will have reasonable response to the request of a patient for appropriate and medically indicated care and services. All right? So, ito yung you are admitted or your medical care is taken care of by this hospital, this team of doctors. But the patient, for some reason nga, will need to transfer to another facility. So you have to allow that, no? And transfer must be accepted by the receiving end. You have to give the complete information, no? Para naman hindi paulit-ulit, it would be cost effective for the receiving end, no? And the continuity of care, no, will not be disrupted for our patients. So the patient has a right to ask and be informed of the existence of business relationships among hospital, educational institutions, and other healthcare providers or players. Ang lagi kong binibigyan example dito is UERM. We have the Pay Hospital and we have the medical service or charity hospital, no? So, for example, I see a patient in my own clinic and cannot afford the Pay Hospital. I will have to explain ano yung medical service ward, no? Sino ang mag-aalaga sa kanya, residente but under the consultants, ano ang i-expect niya, no? Na may mga estudyante na magi-interview sa kanila, no? So, laging dapat alam ng pasyente kung ano man ang any relationship, no, from your end to the other end. Okay? The patient has a right to consent or decline to participate in proposed research studies. So if, for example, you are a primary investigator, co-investigator, or knowledgeable of such a study, let's say IgA nephropathy may pinost sa group ninyo mga nephrologists, you can enroll your patients for this, no? And you think your patient can benefit, no? Explain mo lang, but do not coerce them not to participate in this study. 11, the patient has a right to expect reasonable continuity of care when appropriate, all right? So, ano ibig sabihin ng continuity of care? Nakita mo yung pasyente, inaalagaan mo na siya or nagsimula ka ng treatment, no? Dapat alam niya kailan ka makikita ulit, what is your clinic schedule. If you're going to admit the patient, you're going to make rounds on the patient daily or as necessary. If you're going to assign another physician because this is not your, totally not your expertise, no? Outside your outside your capabilities, then you have to inform the patient. Okay? Kailangan alam ng pasyente ikaw ang in charge. And lastly, the patient has to be informed of hospital policies and practices that relate to patient care, treatment, and responsibilities, no? For example, may mga problem, no? Whether tuwang-tuwa siya sa inyo or puring-puri niya yung ang team of doctors, the nurses, the hospital, or meron siyang grievances, meron siyang conflicts, meron siyang complaints, the patient and the relatives know how to express their own feelings or to resolve their own problems. So alam niya that there is such a community department where they can, give their grievances or complaints, for example. And it will not be in any way a problem, no, in the continuity of care of this particular patient who has some problems to resolve. Okay, I think that's it. Thank you for your kind attention. I can now receive questions.
Versus 100% of colloids can remain intravascular after one hour of administration.
Thank you.
Their half-life is also dependent on certain.
Thank you, Dr. Alcantara.
Salamat po.
Yeah, we'll now have the open forum. So you can ask your questions directly to Dr. Alcantara through the chat box or unmute yourself. Go ahead.
What is the penalty when one violates the code of ethics? Okay. Actually, wala pa akong alam na natanggalan ng PRC except, okay. I think there's due process, no? For example, well, I know of a case, pero the two doctors mediated, no? Parang wala namang natanggalan ng license, but there's due process. Parang similar to a court, no? They have their data and one party has their data, no? So, the penalty, pwedeng reprimand, as the Code of Ethics would tell us, pwedeng suspension or revocation of our PRC. Pero parang wala pa akong kilala unless Dr. Chua would know anybody whose PRC was really revoked, no? Tinanggalan siya ng lisensya to practice. In the hospitals naman, sometimes if there is an internal peer review, no? And the Institute of, for example, Surgery would decide that this particular surgeon will have to be suspended for 3 months, no? Suspended of practicing lang, no? And then pending review. So I participated in such peer reviews, no? In one of the hospitals that I go to, but nothing more than that. Intact pa rin yung license ng doctor. You can just unmute yourselves if you want to ask questions. The question yesterday was, aside from underage patients, sino yung mga sino yung pasyente that you can take over the in emergency situation. So sabi ko, anybody who has lost consciousness, no, or confused patient or lifeless, walang pulse, no, so you have to answer to that situation. I've been to several. Okay, someone losing consciousness in front of you. You're not, of course, in the hospital, no? Somebody, you're being called dahil walang pulse, walang blood pressure yung patient, no, in their home. How do you set your professional fee? Is there a standard amount so we can know when it's too much or too little. Like for the outpatient, it is different for the hospitals that I go to, no? Like I go to a national or public hospital, government hospital. So for my outpatient fee, alam ko yung ibang mga fees ng doctor, no? Let's say, for example, 700 or 800 or 600 for senior. So we give senior discount. But for another private hospital, I can charge a little more because that's the going rate. Okay? Pero yung rate na yan, ano naman yan eh. Or, for example, they have their medical insurances, no? Mga healthcare policies. We only receive 350 pesos. So that's okay because you consented that you will treat their patients. For example, this medical insurance company. So iba-iba rin. So for medical insurance companies, maliit talaga yun. Even if they get admitted, yung fee nila, we stick to it. So that's okay because you signed their contract. When it's too much or it's too little, siguro, like for us internal medicine doctors, so sometimes our basis would be like a daily rate. So, pero usually hindi na namin pinapractice yan eh. Like for example, you initiate a dialysis patient, no? We discuss among ourselves, for example, in the National Kidney and Transplant Institute, the department has some guidelines, no, on how to charge more or less. Okay, more or less. You will know if it is too much if the patient asks for discount. Siguro yun na lang. Or if you're co-managing a patient, no, and then may provision naman eh. We talk among ourselves, so magkano ba kaya ang kaya nito? Sabihin ko, for example, kayo na mag-charge dyan kasi inopera mo yan for gallbladder. Ako naman nag-coordinate lang ng mga doktor. So you can talk among yourselves. Thank you for those questions. So siguro, young as you are, no, be mindful of handling information, no? Like next year, you will be interviewing patients in the wards, no? So uulitin naman ng inyong preceptor yan, no? But don't discuss cases of your patients elsewhere.
Okay, wala nang question.
Wala na yata, sir.
Wala na? O sige.
Salamat
Thank you
po.
very much again, Dr. Alcantara. And for the rest of the class, we will be dismissing you. Have a good day, everyone. God bless.
Thank you po.
Bye-bye.
Thank you po, Doc.